Hello everyone and welcome to my health and wellness channel. I'm Dr. Gauri Bhede and I'm a medical oncologist. We are continuing our series on sleep issues since it is such a prevalent problem. In fact, it's a very common problem in my household. Many studies have shown that at least one-third of the population in the United States suffers from some form of sleep problems. In a previous video, we had reviewed the normal sleep cycle and what it does for you. About 7 to 8 hours of sleep appear to be necessary for most people. During this time, brain circuits are cleaned up, memories are consolidated, tissues are repaired, and in newborns, brain development occurs. Most well-rested adults fall asleep within 10 to 20 minutes of attempting to fall asleep and then spend less than 30 minutes awake during the night. Insomnia has two main components: nighttime sleeping issues and daytime dysfunction issues. And in addition, in order to have a diagnosis of insomnia, you actually have to have the opportunity to go to sleep. Being kept up all night by your newborn or your young children just doesn't qualify for insomnia, just sleep deprivation. The nighttime sleeping issues can be difficulty initiating sleep, that is taking more than 30 minutes to fall asleep, or difficulty maintaining sleep, that is staying awake more than 30 minutes during the night. Early awakening can also be a problem, that is waking up more than 30 minutes before you actually need to wake up. The daytime dysfunction issues include one or more of the following: being tired all the time, being unable to concentrate, having an irritable mood, having poor motivation, making more errors, and then being sleepy during the day and worrying about being unable to sleep at night. If you don't have daytime issues, then you are the person who doesn't need 7 to 8 hours of sleep every night. Besides insomnia, there are other sleep disorders. A delayed sleep-wake phase disorder, which can also be considered a night owl circadian rhythm. This peaks in adolescence, and we all know those teenagers who don't go to sleep at night and then have difficulty waking up early in the morning to go to school. In fact, this may persist into adulthood, and I know one very successful academic who has been able to structure her entire work life around her circadian rhythm. This was apparent during her toddlerhood, and this exhausted her parents who had regular working hours. These people can get their full quota of sleep if they're allowed to follow their own circadian rhythm. In contrast, the insomnia patients have difficulty falling asleep at any time of the day or night. In contrast to chronic insomnia, people can suffer from short-term insomnia in response to specific stressors. Examples of these stressors are mostly situational: a job loss, an argument, a divorce, the death of a loved one, and so on. And by definition, this lasts for 3 months or less. Chronic insomnia can linger on for years. Sometimes it starts with a trigger, sometimes it does not. Symptoms can wax and wane from night to night. Keep in mind, we are only talking about difficulty falling asleep or staying asleep. If you have daytime difficulties without obviously being unable to sleep, then there may be other sleep disorders like sleep apnea. Insomnia can be diagnosed by keeping a sleep diary or by self-report. Sleep apnea requires additional diagnostic tests like a sleep study. If these are not available, then observational reports by a sleep partner can suffice. Sleep apnea is associated with a drop in blood oxygen levels, and it has many other medical consequences. We will address sleep apnea in another session. It is very distressing when you cannot sleep. I know that from personal experience. What can you do to treat it? First, start with having a good sleep hygiene. This involves having a regular bedtime and a dark, undisturbed place to sleep. Avoid watching TV, checking email, or other electronic stimulation before bedtime. Besides the light stimulation, an unwanted email can agitate you before bedtime. Don't bring remnants of work to bed with you, which will remind you of all the things that you still need to finish. Exercise, but not right before bed. Good exercise can tire you out, but vigorous exercise right before bedtime can rev you up. Avoid excess alcohol. It can appear to help you fall asleep, but it disturbs the sleep cycle and creates more sleep issues. Obvious things to avoid are caffeine and nicotine, especially from the afternoon onwards. Meditation, relaxation of the mind and body, and deep breathing exercises are useful. Counting sheep may have been a useful tool to focus on breathing and relaxation, although I have not found it a useful tool. Muscle relaxation can be a consequence of deep breathing, and in addition, there is a way of relaxing muscles with alternate tensing and relaxation of specific groups of muscles. If you cannot relax with these measures, seeing a counselor may help you solve underlying issues. Dealing with the stressful situation is key, but that may be out of your hands. So, what you can do is modulate your response with these various techniques. The common over the counter sleep aids are mainly antihistaminics like Benadryl or diphenhydramine or doxylamine succinate. The sleep effects are a side effect of these drugs, but the body develops a tolerance with continued use, and they are not effective sleep aids anymore. In addition, do use these medicines with caution if you have high blood pressure, heart disease, or lung problems, as they can increase the heart rate. Melatonin is a hormone that is produced in the brain and it sends sleep signals to the brain. The production is influenced by the day night cycle, and taking it can be beneficial to those who work the night shift and need to sleep during the daytime. And it can also be useful if you are jet lagged after changing multiple time zones and need to reset your body's clock. Glycine is an amino acid that may help improve sleep, although it is unclear how it works. It plays an important part in the nervous system and may work by decreasing the body's temperature at sleep time. Foods that are rich in glycine are beans, spinach, cabbage, kale, and bananas. Tryptophan is another amino acid that may help you fall asleep faster. People attribute the post Thanksgiving slumber to the high tryptophan content in turkey. Tryptophan containing foods also include dairy, eggs, bananas, seeds, and nuts. Magnesium is an important mineral for brain and heart health and is associated with increased levels of gamma aminobutyric acid, or GABA as it is also known. GABA is a brain messenger with calming effects, and increasing your magnesium intake may help with your sleep issues. Lavender aromatherapy is popular for its soothing effects. Some people use it internally, but safety and efficacy data have not yet been established. Ginkgo biloba is another natural substance which can be taken before bedtime and may help with sleep by reducing stress and improving relaxation. But do be careful of consuming kava supplements. Kava is a plant that is found in the South Pacific Islands that has been linked to sleep promoting effects. People drink tea made from its root. The supplement has been banned in Europe because it has caused liver damage, which may possibly be due to contamination. If you are suffering from sleep issues, you can start by keeping a sleep diary and seeing whether a pattern emerges. Then look at what changes you can make to your daily habits. Use behavior modification and relaxation techniques to help you get a restful sleep. Thank you for watching. I hope you found this information useful. Do hit the like button and leave any comments below, and subscribe to my channel for more interesting information coming your way. Take care and be in good health.